thing I'm going to do is wash my hands. Okay. Alright. Put a little too much on there. Okay, I'm recording. Alright. Hello, how are you? My name is Isaac Harjo. I am a student physical therapist assistant. May I get your name and your birthday, please?
Melissa Harjo, 11/23/1984.
All right, thank you. May I call you Melissa? Is that okay?
Sure.
Okay. Melissa, what we're going to be doing today is our PT has us going through a little bit of what we call manual therapy. I'm going to be doing manual therapy, and then we're going to be doing some Therex, and then I'm going to give you a HEP, home exercise program. Is that okay?
Yes.
All right, it's okay if we begin.
Yes.
Okay, so there's a couple of things that I want to ask you before we start. One of them is for the joint moves and the physical therapy, the manual therapy part. I have to ask some questions. Do you have any on your shoulder area? Do you have any marked varicose areas where you have varicose veins, a lot of veins in them?
No.
No. Oh, any open wounds or lesions?
No.
How about any gross edema?
No. Nose.
Or splitting that's not going to split or anything when we work on it? How about any sensitive skin?
No, I don't think so.
How about swelling from any kind of heart condition, CHF, anything like that?
No.
Fracture in the area?
No.
Any cancer?
No.
How about hypermobility?
No.
Okay. It was okay. Pregnant?
No.
Do you have RA?
Do I have rheumatoid arthritis?
Yes.
No.
Osteoporosis?
No.
Spondylolisthesis?
No.
Ruptured tendons or ligaments in the area?
No.
Nothing like that?
Nope.
Okay. So, with that, since it looks like we can go ahead and go on with our therapy, the first thing that I want to do is get you a massage on your shoulder. So,
Okay.
is it okay if we start that?
Yes.
All right. So, what we're going to have is I'm going to have my oil here, and what I'm going to do is I'm going to go ahead and drape you just so that I make sure that you feel okay with everything and stuff like that. Okay.
Okay.
Feel okay?
Yes.
All right. So, what I'm going to do here is, I'm going to get my paper so we're doing everything we're supposed to. Okay. So what we're going to do first is, she's still draped there.
Do you want me to pull my shirt up?
Yes, well, I'll pull it
Okay.
so I can get to the areas I need to get to.
Thank you.
Okay. So the first thing that we're going to do is, I'm going to do a little massage. Whoa. Okay. We're going to do a little massage here. And I'm going to just warm up my hands here so that you can kind of get used to my touch. And the first thing I'm going to do is, this is going to be a effleurage massage.
Okay.
And what I'm going to do is just kind of get you used to my, so if I just have you stick here on my hand, just kind of get you used to my touch. Is that all right?
Mm-hmm.
Does that feel okay?
Yep.
What I'm doing here is we're getting some flow, some venous and lymphatic flow into your system, getting circulation moving, bringing blood to the area, getting rid of any kind of waste products that are in here, swelling or anything like that. Okay? Does that feel okay?
Uh-huh.
Okay, I'm going to get into your shoulders here. Is that okay?
Yeah. Feels good.
Okay. adverse reactions to this or anything?
Nope, I don't feel any.
You feeling relaxed?
Mhm.
Feeling good? Okay. Okay, so the next thing I want to do is we are going to do some pepper massage. So what I'm going to do is I'm going to just do these nice little circle motions here. Okay. And up here I'm going to do it with my fingers, okay?
Mhm.
Feel okay?
Oh yeah, feels great.
And so what we're doing here is we're kind of just breaking up that scar tissue that is, since you have like a hard time moving your shoulder here,
Mhm.
we're breaking up some of that scar tissue or any kind of adhesion. That's what we're trying to do here. So we're going to be working circles like that. Does that feel okay?
Uh-huh.
Really want to work on this muscle right here because the most pain you're having is coming up, and this deltoid helps you bring your arm up. So we're going to put some extra work on there. Is that all right?
Mhm.
And then the next thing after this, I'll probably working on your scapula area. And I'm going to do it's called a deep tissue massage, but I'm just going to kind of work on releasing your scapula so that we can get more arm range, okay?
Okay.
Does that feel okay?
Mhm.
So prior to this, what would you rate your pain as? It was, I know it was an 8, earlier, so is it still pretty bad? So
Right now,
on 1 to 10 before I started doing this.
before you started this, it was an 8.
Okay. How's it feeling now? Is it feeling better? Can you feel it relaxing?
Oh yeah,
Okay, good.
and it's like distracting from the pain too.
Oh, okay, good. Okay, so the next thing I'm going to do is we're going to I'm going to use a 4-year.
Mhm.
I'm going to use this little technique I got here. It's going to be, I want to make a cross right on the border of your scapula. Does it tell me if it's too hard? I don't want to make it too hard. Feels
No.
okay?
Mhm.
Okay. And then I'm kind of looking for any areas that are tight, and then I'm going to work on them, okay?
In the scapula.
In the scapula, yeah, so that you can get more range of motion. We're going to, if it's tight in there, we're going to loosen it up, break anything up. Feel okay?
Feels good.
So we're working on this trap muscle here. You feel like you're feeling any release there?
Mhm.
So now you let me know if I'm going too hard. You let me know. I'll ease off. And still okay?
Mhm.
Felt a little give right there. So
I know, it feels like you're
it's working.
hitting spots that
It's
hurt.
definitely hitting trigger spots to release some of your tightness and very basic pain. Okay, how's that feel?
Really
That feel good?
Yep.
Okay, so what we're going to do next is we are going to work on joint moves. So what I'm going to be doing is she is feeling pain in abduction at the most. So what I'm going to do is I'm going to do an inferior glide where I'm going to distract a little bit. I'm going to move down into the beginning of the beginning of the range of motion. I'm going to oscillate small oscillations. So what I'm going to do is I'm going to go ahead and pull her out here. Order an abduction, 5 degrees, 55 degrees. Hold right here. Distract. Then we're going to do an inferior glide, go down. I'm going to oscillate 3 to 6 seconds per second or 60 to 80 per minute. I'm going to do it 4 to 5 times. Okay? So I will distract, inferior glide, grade 1 within the beginning range of motion. Do that for 60 seconds. Okay. Then we'll do it again. I'm going to pull out. We're going to distract a little bit. Inferior glide for the abduction. Since it's a convex on concave, we are going in the opposite direction of the moving limb. Okay, do it one more time. Distraction, inferior glide, beginning of the range of motion, 60 to 180 times per minute. Okay.
Yeah, what's this supposed to do? It feels like it's stretching my whole arm.
Well, what it does is it relieves your pain. Alright, since that's how I would do it, but it's a little bit different. Okay, so we're going to, the next thing I'm going to do is, we're going to do some Therex. And so, what we're going to do is, first we're going to do some standing reaches. Okay. So, what I want to do is
Gonna bring this back.
Mhm.
It feels fine. Feels like it's so good.
Okay. All right.
Okay.
So, all right. So the next thing we're going to do is, I want you to stand up. Go ahead and stand up. There you go. Nose over toes. There you go. So what I want to do
I
now.
don't think they can see.
Oh.
It's just your straight
Okay.
back.
We're going to stand this way. Sorry about that. Okay. So what we're going to do is, we're going to work on your reaching. So what I want you to do is I'm just going to hold my targets out, and I want you to move across and just touch it. So what we're going to do is try to work on some range of motion, stuff like that. Okay, so we're going to do 5 times to each side, 2 sets. Okay?
Okay.
So we're going to do, go ahead.
Like that?
Mm-hmm. Okay. There you go. There you go. 5, 6, 7, 8, 9, 10. Okay, rest for a second. How do you feel?
Pretty good?
Feel okay?
Mm-hmm.
All right, let's do it again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. All right, good job. You can have a seat, take a little break. Good job.
Yeah, my shoulder was popping.
Okay, so the next thing we're going to do, I'm going to let you take just a little break, about a 20-second break. We're going to do bilateral arm raises. So this is going to kind of help us gain some range of motion. It'll be a little bit of an active assistive range of motion. So what we're going to do is we're just going to go right up there until we don't want to go into the pain part, but we want to we want to get there, we want to start working on that range of motion, and we're going to use it for strengthening exercise, bringing our arms up. Okay? All right, let's get that going. Okay, let's go ahead and stand up. So, watch your shoulders there. Okay. So what we're going to do is we're going to put
You
this up.
gotta turn. Okay.
We're going to do right here. So
Okay.
I know that we can only, right now you have 7 degrees of range of motion, so I want you to go just to where it doesn't hurt, but we're trying to
Okay.
gain range of motion.
That's as far as I can go.
Okay, right there. That's where you want to go. Okay, now go down. We're going to do 10 reps, 2 sets. Okay.
1, 2,
Good job.
3,
Does it feel okay?
Mhm.
Does that feel okay? Okay.
4, 5, 6, 7, 8, 9.
All right. Control it.
10.
Control it. Control it. Slowly. Yeah, there you go. So, do you need a rest, or do you think you can go again?
I can do it again.
Okay. All right. Let's do another set of 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Good job. All right. Okay. Let's take a break after that one.
Okay.
All right. So what we're gonna do next is. Okay. So what we're gonna do next is what we're gonna do. You can do this one sitting.
Okay.
And what I want you to do is just to have it out right here, and we're going to work on this rotation right here. Okay? So that we get a little stretch in the back right here, and we're working our trunk right here also. Okay? So what we're going to do is, we're going to do, for this one, I'm going to try to do 3 sets of 10. If you can't do that, let me know, okay?
Okay.
All right.
Right here?
Right here, yep, right where it's up to where you can,
Okay.
it doesn't hurt.
Then with my arms or my
No,
legs?
you're just moving across.
My trunk.
There you go. You feel that? You feel me stretching the back there? Okay, there's. Go ahead and count out loud. That way you can get some breathing.
Where am I at?
You need to make sure you breathe. You're on 5.
6,
That way, whenever you breathe, you
7,
you count, so you can
8,
inhale. When you make your move, inhale, and then when you come back, count out.
9.
There you go. That way you released it.
10,
There you go.
11, 12.
Good job. All right. So take a rest for a minute, because this one's going to be a little more than the other one.
Okay.
So you tell me when you're ready.
I'm ready.
You ready?
Yeah.
Okay. Go ahead. Let's do it again.
Okay.
Remember to take a deep breath in.
1, 2,
Good job.
3, 4, 5, 6, 7, 8, 9, 10.
Good job. All right. So what we're going to do next, do you feel like you can do another one? Because I feel like it's a good workout for you. It's very functional because you're going to be moving your gill, and you're moving this way and you're moving that way. Do you think you can do another one?
Mhm.
Okay, let's go for one more.
Okay. 1, 2,
Good job.
3, 4, 5, 6, 7,
Getting tired?
8, 9, 10.
All right, that's a great job. I'm really glad you were able to get through that because it's really going to be helpful for us. Okay, so what I want to do next is we're going to do a scap squeeze, and that's to get your posture into where it needs to be. Your alignment needs to be good, stuff like that. Okay, so we're gonna work on that. All right. So what I want you to do is you're gonna be squeezing these muscles right here,
Okay.
and then you're gonna pull your shoulders back. There you go. And we're gonna do that 10 times, 2 sets. Okay?
Okay.
Can we do that?
Sure.
Okay. Let's go. Remember, breathe in.
Okay.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
10.
All right, good job. How do you feel? You feel okay? Is your pain level okay? You're not in any more, not too much more pain that we can't. Okay, because exercise is going to keep us. It's going to help the pain come down and make sure we're nice and active. Movement will help with the swelling that happens in there, and all that kind of stuff. Okay, so it's better to keep active instead of just kind of letting it sit. So, good job. So the next thing we're going to do here is we are going to work on stretches. So you can do this sitting. So the first thing I want you to do is you're going to grab your wrist, stretch your arm out. There you go. Don't go too high so you don't hurt yourself. There you go. So what we're going to do is you're going to push the arm forward, but you're going to have this arm help pull you so that you get a stretch. You should feel your stretch right here. Okay, you feel that?
Yeah.
Okay, so go ahead and let it go. So what we're going to do is we're going to do that 3 times, and we're going to hold it for,
With the same one?
yes, 3 times for 30 seconds each. Okay? All right, go ahead. I'll count. Grab your wrist. Okay, how does that feel? You feel okay? All right, now let's stretch out the other one. Okay, how's that feel? All right, is that a workout?
Yeah.
All right, we'll go ahead and leave it right there on that because I can tell that it was getting kind of harder. Okay, the other thing another stretch that I want to incorporate is the, it's called the lateral side bend, and we just want to hold that for about 10 to 15 seconds. 1, 2, 3, 4, 5. Okay, let's go the other way. 1, 2, 3, 4, 5. That feel okay? All right. All right. So I have an over the head stretch, but I'm not for sure if you can do that. So I'm not going to try that today. I see that was weird because you'd have to go to get all the way up here, and I don't think that that's going to be possible.
Okay.
So what I do want to talk about is your just some basic education about it. We definitely want to you want to keep it moving. And one thing is when you're walking, anytime you're walking, we want to just go ahead and emphasize this movement, okay, so that we're getting some movement in that shoulder.
Turn.
Huh? Oh, yeah, we want to make sure that when you're walking, we get this movement right here, so that it's moving and staying active, okay? And also we want to make sure that you try not to sleep on that shoulder. You don't want to do that. So it's going to put you in that position, laying on it like that. Just don't become immobile. That's the main thing here. And I got some exercise home, some programs while I'm not here. And so what I got here is you've already done this one, which is the double arm raise. I definitely want you to put that one incorporated in there. So,
That one?
yes. So we'll do 2 to 10 times on all these exercises. So do it sitting like this, and then only go up to where you know your pain is. Don't go too much further. And then we're going to do bicep curls, and you can do that also sitting, and we'll just like that. Okay. And if we get stronger, we can progress it with weights or resistance. But for right now, we'll just use this little thing we got right here. Okay.
Okay.
And then I want you to do standing hamstring curls. And that's just for strength when you're walking, when we get you back out into the community and you're doing what you want to do. So what you'll do is you'll stand in a chair and you'll just, and this also, we can progress with weights if we get to that point.
What
Okay?
does that help?
This helps your knee flexion, and it helps with your hamstring strength.
Okay.
Okay, and that helps with stepping and all kinds of stuff, your gait, and makes everything strong. Okay, and then the next one I want to do is the 4-way, and this is also for hip stability and to keep you walking and up and walking. So you'll just do frontwards, backwards, abduct, and in. Okay, and that'll be 1, 2. Okay?
Okay.
All right. And then, of course, we want the good old scap squeeze. 2 times 10. 2 sets times 10. So, with that being said, you kind of leaning on me?
No.
Is there any questions you have for me? Anything at all? You know, just make sure you're breathing right whenever you're exercising. If you feel too tired or if you're dizzy, standing up while you're doing that, have a seat.
Okay.
And if you don't feel good while you're doing it, just discontinue it. Don't continue with the exercise.
Okay.
Okay?
Yep.
But I think for right now, how's your pain? How do you feel?
I give it a 2 out of 10.
2 out of 10? Oh, okay, good. We've really decreased the pain. All right. Well, I guess I'll see you next time. All right. Have a good day.
Thank you.